To get started with core belly breathing and pelvic floor engagement, find yourself in a comfortable seated position. Take a big inhale through the nose and exhale through a soft, open jaw. With your exhales, really let the belly release. Release any tension you're holding. There's no need to hold your belly in to support you. And then try as well to release your pelvic floor, that softening of the hammock of muscles in your pelvis. And so the inhale is that softening and the release. And the exhale, I want you to imagine all the muscles from your back wrapping around to the side body and all the way to the front towards the center line. The linea alba is that center line of the six-pack muscles, and then wrap it all in towards your midline. Good. So the inhale, soften and release. Exhale, engage. Good. Keep breathing at your own pace, allowing your belly to soften and fill with air. And then on the exhalation, that intentional wrapping and hugging in of the abdominals. Good. So as you continue this, start thinking now about your pelvic floor. Your pelvic floor is this beautiful hammock of muscles nestled in your pelvic bowl. It's connected to your bony sit bones on either side, your pubic bone in the front, and your tailbone in the back. And there's a few different ways you can imagine this pelvic floor engagement, but I always want you to remember that a strong, healthy pelvic floor is one that has a full range of motion. So it's not just engaged in tension the whole time, it has to be able to release and then engage fully. So when we're activating our pelvic floor, think of that full, healthy range of motion and not just put the intention on the activation. So a few different ways you can visualize it. I think the most beautiful one is imagining your pelvic floor like a jellyfish. And so the tentacles soften and release, and then they engage and lift up. So everything is lifting up towards the center of the body, the midline of the body. Another way that you could think about it, if you're a more visual tactile learner, is your vagina is picking up a blueberry very delicately. It's engaging, and then just as delicately putting it back down. And the least beautiful way you can think about it is that sensation of stopping the flow of urine, or if you really need to go pee, trying to hold it in. But that's only engaging the front of the pelvis. So to engage the back side of the pelvis, you're stopping the flow of urine at the same time that you're trying to stop a fart. Not the most beautiful one, but it's a very physical one that you might remember. Whatever one works for you, visualize it now and allow that hammock of muscles, your pelvic floor, to soften and release. On the exhalation, start drawing those four bony points together up and into the center of the midline. Good. Inhale, intentionally, gently release. Exhale, engage, and lift it up. Good, now let's combine these 2 points together, the breath and the pelvic floor. It might feel a little bit like patting your head and rubbing your belly at the same time, but I promise you that the more you practice it, the easier it's going to become. Whew. All right, shake it out, let's get it started. Let's inhale and exhale. Inhale, soften and release. Exhale, wrap and hug and lift. Inhale, soften and release. Exhale, belly draws in, pelvic floor lifts up. Inhale, place that blueberry down. Let the tension out of your belly go. Good. Exhale, jellyfish tentacles up, abdominals wrap and hug. Good. Keep going with this. We do this to help encourage the abdominal muscles to draw back in. During pregnancy, they get separated out. A little bit of diastasis recti. For some, it's a more extreme separation than others. The organs have shifted all around to make space for your baby. So as you're in this postpartum period, they're traveling back into their home place, and your pelvic floor is supporting amazing things that are in your abdomen. You've got your stomach, your bladder, your bowels. All of these things are being supported and lifted up by the pelvic floor. So to help prevent or repair organ prolapse, urinary incontinence, bowel incontinence, this engagement is going to really help reconnect your body back together. So keep practicing. Let me know what you think about this, and I hope that it's helpful. Thank you.